And hi again, everyone. TJ All's I-45 now in Galveston now with our next episode now of Health Care Unmasked presented by UTMB Health. Glad to have you on with us here today. An important topic. We'll be talking about mental health, and mainly where we're going to be focusing on a lot of this is dealing with youth issues as well as young adults, where we are having some problems across society with this and how we can talk to you about with it, bring in some experts to really talk to you about how to adjust in your lifestyle if this is an issue that you're having in your family with your own children or even yourself if you're a young adult watching us, as we do have medical students who are on with us in that age there. So we're hopeful that this will be a discussion that you can join in with us here. You can always comment in our feed as we go along here. And now let me just cut on over now and welcome our guests here today. First up, the one, if you're looking on your screen, is to your left. It's Dr. Barbara Calvert with us here today. Thank you for being on with us.
Thank you.
And then she says call her Dr. G, but we're gonna make sure we get it right. And Dr. Kim Gushanas is on with us as well. Let me just start with you, Dr. Calvert. Kind of explain, because you are both from psychiatry and behavioral sciences. And it used to be it'd be just psychiatry. That the title would be, you're the Department of Psychiatry. Explain why it's important now to talk about behavioral along with that now, and in the behavioral sciences along with that title.
Absolutely. I think that title really encompasses that mental health concerns are not just treated with a medication, and medication is not the only option. There are other therapeutic options like psychotherapy, counseling, things of that nature, behavioral interventions that are very evidence-based to treat mental health concerns. And the treatment of choice for pretty much any mental health diagnosis or concern is medication in combination with psychotherapy. So we really want to encompass that we have to look at it just beyond medication.
And one of the things, Dr. Gushanas, we talked about, as people know who watch the show, we have a pre-meeting with all of us getting there, and we're just kind of spitballing ideas and the like. And one of the things I brought up with both of y'all when we had our pre-meeting was, all right, the discussion, we hear mental health, and folks think it's in one particular area. Mm-hmm. That mental health is dealing with folks on the extreme end. Mm-hmm. Actually encompasses a whole lot more. Can you kind of give us a breakdown so folks can understand that the stigma we may associate with psychiatry mm-hmm. or with mental health issues is something that needs to be worked on?
Yeah, absolutely. Barbara and I were talking about this last night as well. I think knowing that mental health is a spectrum, and I in fact, in my training, I got away from using the term mental health, and I just talk about healthcare in general, because mental health is a component of that. And I think that people often, like you said, think about the extreme versions, like the very severe or acute diagnoses, the images that we see in the media, or the problems that are discussed socially about, the more severe issues that come with someone who's been struggling with mental health or mental illness for a long time. But what we know is actually mental health is a component of everyday living. So making sure that you're attending to your mental health in addition to your physical health, your social health, spiritual health, financial health, these are all components of daily life. So we try not to think about mental health as something that is only to the point where you need treatment or where you need psychiatry, medicine, therapy. In fact, I work with kids all day that don't have any specific diagnosis or any specific illness. They just have stress, or they have things that they're dealing with that they need some objective person to talk with. So therapy can be as little as getting support, having a social system, all the way to the other end of something more significant like a treatment, intervention, or some kind of hospitalized method of care.
You just brought up you deal a lot with children.
Yes.
What age ranges do you focus on?
Really all of them, because I specialize in working with children, primarily in pediatrics, which means I work with children, but also their parents. So I get to work with the whole spectrum of ages, and sometimes grandparents as well. So I primarily see kids in the ages of, for therapy, in the ages of like 8 or 9 to 24. But I do see very young kids as well. Primarily when I'm doing that, I'm working with the parents though.
And Dr. Calvert, you specialize more in younger adults, right? And what is that? Is it, because I think of younger adults, it's 20 and up, but it's more of kind of, it's like 17, 18 and up from there. What is that range when we say that?
So young adults generally, yes, my primary age group that I see would be 18 to 26 or so. And that's because the bulk of my clinical work is at UTMB Student Health and Counseling. So any of the UTMB students across campus enrolled in any of our programs can seek services at Student Health and Counseling for their physical health care as well as their mental health care. Then in the Webster clinics, or Webster Psychiatry clinics, I do also see adults. So that can range from 18 all the way up to someone who's 100.
Yeah, I mean, so it's age is just a number, right? And they say, and Dr. Gushanas, you said something that I found interesting, so that with younger children, sometimes it's just stress, and I'm sure there's a lot of folks who may have heard that, and I hear this from people when they're dealing with certain things in life, that it says it's a 5-year-old. What type of stress does he or she have? This is real. A real issue. What the days of thinking, oh, they're just being a kid, they're just having a temper tantrum, or they're disconnected from stuff because they're just a kid. That's not true. We actually know a lot better about that now, don't we?
Absolutely. Yeah, we've learned a lot about how cognitive development and child development works. The past 10 to 20 years of literature and research in this area have really shown us that kids have a lot more awareness of what's going on in their environment. We use a phrase in my training that children are like sponges. So whatever's happening in their environment, they may not necessarily understand it, but the emotion behind it, they feel that. So, it's true with animals too. It's not just humans. So we have an experience as a human being that sometimes, and this is not just for kids, adults too, we can't label it. We don't know what it is that we're feeling, but it's there. And that adds up over time, especially when a kid, has a situation where they may not have good support. They may not have good skills to deal with stress or to deal with the emotions that they do experience.
And particularly with children, you in a situation is that obviously the child's not going to have the tools or the understanding to work through an issue they may be having, whether it's emotional, a behavioral issue, or like you said, stress. So this is where it really takes the parents and those around teachers and stuff that there's a bigger role here now in just saying, oh, just go outside and play, or that was how, if I was having a bad day, that's what my grandmother would say, whatever we do.
I agree with that advice.
Oh, okay. See, okay. So it was good advice. My grandma Hill was right.
Yeah.
Okay.
Yeah.
So explain, because some people may take it to the extreme like I was going to there, but that it's not used. It is good advice. It gets you out of your space, I take it, and where you are.
Change the scene. I think adults could use more playtime too. I think, you're right. Kids, especially younger kids, don't have a lot of the cognitive capacity to understand or to put words to what they're dealing with, or to know how to kind of organize themselves to deal with a problem if it comes up. So they rely and borrow those skills from their environment, whether that's parents, other caregivers in the family, teachers. A large part of my clinical work is working with parents and consulting with schools or medical providers. So I would say almost 50% of my clinical day is working directly with the family or the school.
But it is an all-encompassing approach.
Absolutely.
Needs to be, right?
Yeah, it has to be.
And Dr. Calvert, she said it best. Adults need some playtime too.
Yeah,
which, by the way, I'm taking that recording and I'm going to show it to my wife. I said I need some playtime too for that. But it is, I guess, the time is, the time we say I need some personal space, or I need a mental health break. Those are important. Absolutely. And so much in society now, I think, is folks forget that part of this. We don't have the whole, you get off at work at 5, your shift ends, you go home, you have dinner, you have a routine, which you're just not doing. You're not stressing about work. We don't have these sending us messages all the time. So it's just as important for adults to be taking this approach too, right?
100%. I think when it's an adult, it just is defining what is that leisure time and that self-care time look like for you. What do you value? How do you want to spend that time? And what truly recharges you? I think far too often what happens is we need a break, so we end up just kind of taking one. But it might be that we just doom scroll our phone for an hour, and that's not something that we value. That's not something that rejuvenates us a way we want to spend our time. So then it didn't really feel like a break, or doesn't really feel like we did a lot for ourselves. So I think as adults, making a conscious effort to think about, how do I want to spend that time? What does rejuvenate me and recharge me? And then being able to carve out that time for yourself and make it a conscious effort, and that commitment to yourself to say, I'm going to make this a priority. If going to the gym is your leisure time and what recharges you, making that a priority and figuring out, how do I be successful in achieving that goal, and making sure I am keeping that commitment to myself, whether it's communicating it to others so they can help support you in that and help you make sure you're doing it, letting others know what it is that you need, but making that a conscious effort and that commitment to yourself.
And commitment to yourself. One of the things I think we have noticed, I noticed in the sports world here, and this is where I give Osaka and I give Serena Williams a lot of credit on, because there was a lot of criticism when, and forgive me for not remembering, the great tennis player, and I should remember Osaka's first name, but when she took her break, and in the sports world, this is kind of showing them the masculinity, stuff that still continues in that, where like, you can't do that. You you got to get out there and compete. And she said, no. That was a pretty brave move, was it not? I'm using that as more of an international kind of perspective, where the whole world was, commenting about this. And the only, yes, there were some negatives, but I thought the good that came out of that was that people were discussing it. That's something we three talked about yesterday. Having the discussion is where this really starts, does it not?
Absolutely. Yeah. And I think too, that kind of really correlates with how we approach mental health, especially in children, is talk about it. I mean, you can't beat the stigma of anything, not just mental health, but like what Osaka did, taking a break for motherhood or for mental health. These things in our society, they need to be discussed. And so it's the same with mental health. And I tell parents this all the time. If you want to help your child, if you want to teach them how to care for themselves, have the conversation with them, check in with them regularly, make time to talk to them about how they're feeling, good and bad, not just, tell me all the good things that happened today. What are you proud of? What did you accomplish? But also, what was the hard part? Like, what are we going to do next time if that comes up? Or how can we work on making that feel better? Or just learning to sit with difficult emotions. And kids really need parents to tell them that they can do that.
And let me just ask, y'all are both very young, so, none of y'all know what the 50s are like or anything like that. But I would think, though, that the impressions that some people will have of an older generation of, well, back in my day, it really wasn't that. We were just ignoring the real things in society. I had someone, when I was bringing up that we were going to have this topic today, says, why has it all changed now? Why is it so bad now? And I said, I'm not so sure what we're seeing today is bad so much, is we're recognizing the problem more. Would y'all agree with that?
We're much more willing to talk about it. Whether it is someone in the media taking that break, or putting out and being open about their mental health struggles. I think the younger generation is much more willing to talk about it and say that they need that break. That's one of the biggest things we can do to continue decreasing the stigma, is to be willing to talk about it and have those conversations, like Dr. Gushanas was saying. And even as an adult, being willing to check in on your friends, your loved ones, your family members, when you start to notice, hey, they don't seem to be doing okay. Something seems to be a little bit off. Let me talk to them, see if they need some support, if they need some help, and if they're okay. Like, that's one of the biggest things we can do to decrease the stigma, and have that conversation and make it a safe conversation for them to have.
And when we come back, we're going to take a quick commercial break here. When we come back, I want to dive a little bit more on how someone, not only how they're supposed to recognize what they may be seeing, but what's the approach? I think a lot of times people will take, and they're not sure what their approach should be. And we'll be talking about that when we come back after this word from UTMB Health.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB health specialist near you, visit utmbhealth.com.
And welcome back to UTMB's Health Care Unmasked here on I-45 Now and Galveston Now, as we continue the discussion about mental health and behavioral and emotional health, as well as we go through this today. And again, my guest on the show today is from the Department of Psychiatry and Behavioral Sciences here at UTMB, and it's Dr. Barbara Calvert and Dr. Kim Gushanas on with us as well. Dr. G, I know I said Gushanas and Gushanas instead. I'm sorry. I knew, I said I'd already do that like 35 times yesterday. Before we took the break, both of y'all mentioned about recognizing this, about, hey, my friend or my loved one is having a situation. I wonder if there's something, is everything's all right? And it always starts with, I know this person. I'll say, you okay? And the first reaction from people I care for, most of them, when I say this is, oh, I'm fine. I'm just tired. Or, oh yeah, it's just a busy day. That in itself should probably be a signal that it's not about them being tired. There's something else on their mind. So how do you, approach someone to really find out, hey, do they need some help here? Do they just need support? What does it take? And then the other is, then if they say what's going on, how do you deal with that? Because most folks here, like, as I said, I use the sports vernacular a lot of times. Put some dirt on it and and walk away. But it's way more than that. And who wants to tackle that first?
Well, I think for me, what I like to communicate is kind of the signs and symptoms, right? That somebody's not doing well or not themselves. You'll see that in their daily life. So you look for changes in behavior. Did they stop doing an activity that they usually do? Have they withdrawn socially? Are they not wanting to spend as much time with you? If they do spend time with you, are they distracted? Are they having difficulty concentrating? So there are kind of outward behavioral signs that you can see that a person's changed. And usually it's obvious. I think most of us pick up on these things. The other thing I like to pay attention to is my own reactions to that person. So if I'm feeling really irritated by somebody, a lot of times it's just me being irritated, but sometimes it's something that's happening in that relationship that's different and I don't like it. And so I have to sometimes ask myself, like, why am I feeling this way? Or maybe I'm like feeling the need to check on them more. Why am I doing that? And kind of recognizing both the changes that you see in them and also in yourself, if it's a relationship that you have.
And I think when you bring it up or have that conversation with someone, it's pointing those things out, like being specific, not just that, hey, how are you? But hey, I've noticed I haven't seen you at this group meeting that you were coming to every week. Like what's going on? Like, and really being specific, pointing out some of the differences that you've noticed or changes that you've seen to open up that discussion more. And I think also for my young adults, I always really talk to them about checking in with themselves. Hey, how am I doing? Am I meeting my goals? Focusing on my wellness in the ways that I want. And I think that really has to become a part of, almost like I call it our weekly prep, like on Sundays, if you meal plan and get ready for your week, it needs to become a part of that. And we have to have a way to make sure we're doing that regularly so that it doesn't get to a point where something is a crisis because we haven't been monitoring it. And all of a sudden, this is a major crisis and something that needs to be dealt with in an emergency situation.
And that's one of the other things we talked about was that all too often by the time we realize, well, I want to say by the time we realized, actually we realized it before, we just didn't act on it, is that by the time something major crisis happens, you can then go hindsight 2020 and see all those opportunities. And I think that's where a lot of guilt comes in for folks to say, oh my goodness, I will. And, also let me just go with the disclaimer that you see at the bottom of our screen. At times we are going to be discussing suicide, self-inflicted death throughout this program. And if you or anyone may need some help, just remember the National Lifeline is at 988 that just rolled out not too long ago. And we're going to talk a little bit about that too, about its roles, but do so. But I've had friends who've taken their own lives, people in my family too. And what happens after that is that whole moment after, not moments after, that you just go, if I had just. Now, we understand some of that guilt, but that's really also not the approach you need to be taking after that, or is it? I always feel weird when I'm like, so I should have done this. Well, I didn't do it. So now, what do I do with that? Because now it's causing stress on me. It's causing my emotional health to deteriorate some. So what should that approach be for someone when we've gone to that crisis mode? And then I'll back it up even further. I'm going to kind of break this down as we go back some on that.
Well, I think after anyone has died by suicide, that's a normal reaction for the loved ones around them to think, oh my gosh, I should have done this. If I had just done this. I think that's a normal reaction. So I think it's important to recognize those thoughts are going to come up and learning that they will also pass. That's not something that will stay. But yes, it is not the most helpful approach to continually circle that. But looking at, okay, how do I go forward from this? What can I do going forward, whether it's in future situations, or what did I do that was helpful to not just circle that if I should have, would have, could have.
And I would say with children, when you get in a situation, it may be a little bit different, because particularly if it's one thing if you're the parent and you've got to deal with the situation.
Yeah.
But if you are a relative of, or even just a good friend of, and you could recognize what's going on with, let's say their 10-year-old, how should someone approach that?
Yeah.
And do they go to the parents? Do they just kind of check up on the kid, but not being so blunt with it? How should they handle that?
Yeah, it's a really difficult question. And I think a lot of people are struggling with this right now. I don't think it's too different, because kids who talk about having suicidal thoughts or urges, it's very, very similar to what we experience in adulthood. So they're having very similar types of thoughts, the same kind of existential feelings of being a burden on other people, or feeling like they don't belong or no one loves them, being lonely. Those are all the same symptoms that adults who have suicidal thinking experience. I think for kids, a couple of things that I like to think about is, one, knowing the risk factors for suicide, especially in children, kids who have prior mental health concerns, or who have expressed anxiety or loneliness, or even other issues like ADHD, which includes like a kind of an impulse control component. Those kids are at higher risk for developing suicidal thoughts during stressful moments or when a crisis comes up. So knowing some of the risk factors to suicide can be really helpful for people to just know, like, okay, well, I might want to check in a little more often with this type of person or with these kids, especially if you work like in a school system, being aware of that. But in general, I say, one, ask the person directly. I think a lot of people are scared of asking questions directly about suicide. Have you ever thought about that? Or have you ever had those types of thoughts? Have you ever wished you were dead? People think that that's going to give kids an idea of suicide that they didn't already have. And we've learned from years and years of research that that's simply not the truth. That is a myth that we've bought into because of our own fear of talking about these things, which makes complete sense. But it's actually shown over and over again in research that asking those questions is a prevention method for suicide.
And it's interesting because I've always heard that don't ask someone about that because you've planted the seed that may not have been thinking about it.
Right, all the time.
Yeah.
But it's the exact opposite.
Those seeds are already planted, especially in today's culture where there's this information overload with the internet and social media and news. I think those seeds are there. We're not the ones planting them. So asking is actually helping to promote growth and promote an opportunity if the opportunity is needed.
We have to remember, because of, like Dr. Gushanas was saying, the fear associated with this topic, it's scary to ask about, right? But asking someone directly if they are having thoughts of suicide is the only way we have to get that information.
Right.
What we see happen a lot is people ask it very vaguely. Oh, you're not thinking of doing anything drastic. right? That doesn't get me the information that I need, because to that individual, it might not be something drastic. To them, it's a way to solve it's a solution to their problem.
Right.
And it's going to stop their suffering, which is their whole goal. So we have that fear, but they also have the fear of bringing it up. What if no one cares? What if they don't take me seriously? They don't believe me. Okay. So by us bringing it up directly, we also make ourselves a safe person to talk to open up to, and help decrease that fear of bringing it up. They might have wanted to let someone know for months that they're having thoughts of suicide, but have never been able to bring themselves to actually say those words out loud to someone. So by us bringing it up directly, we're creating a safer place for them to do that and getting the information that we need to potentially save their life.
I think an important part is you've kind of brought this up each time now, is that don't ask the open-ended question. It's not enough to say, hey, how are you feeling?
Mm-hmm.
It is, what's going on? You weren't at this meeting. Give something specific.
Mm-hmm.
Same thing here. Ask them straight up.
Mm-hmm.
Drastic is whatever
That
definition
be
be.
vague, or to them, it's not drastic. So they're
Right.
answering you honestly.
Right.
To them, they're answering you honestly.
And we're essentially trying to pussyfoot around the words that need to be said. So more of a, not a rude approach, but more of a blunt approach, direct approach to deal with that.
Can I add the National Suicide and Crisis Hotline, the Lifeline,
Mm-hmm.
where you can call 988. They also have a website. They have some really great resources for people like lay persons, not professionals like us. Professionals usually get training in this and should, but lay people can too. And that website has some really great resources for people, like how to talk about this, what questions to ask. There's like little pocket cards you can keep, just to have a sense of like, what do I do if this kind of stuff comes up? And it's coming up. This is, I would say, a public health crisis, suicide, and especially in kids, it's one of the leading causes of death in children 10 to 24. So we know that it's happening. It's happening at a much higher rate in the last couple of years, especially. So educate yourself as best as you can. And for teenagers, there's a really great website called Seize the Awkward, and they talk to teens about how to approach these conversations too.
That's a difficult conversation. By the way, what Dr. G was mentioning, that's up on your screen right now, the 988lifeline.org, and then it has the tips that you can go through as well. But it's an interesting thing. I wonder, because teens will talk to them amongst themselves, what they will never say to an adult.
Oh, much more often, yeah.
But that becomes the more, are other teens as compatible with addressing this issue as well? Because they may be feeling the same angst, the same stress, as you've said, just the social media. We saw national headlines recently where, a young man, because someone created out of the air a fake sex scandal about this one young man, and just what was being said online drove him so much, and he didn't feel he had anywhere to go. And then his parents, God love them, they have said right away, we have got to do a better job. But how do you break through to, because one, you need the teens to talk to each other about that and be genuine about it. I think all too often, like I was saying earlier, I'm always asking the question, how are you doing? But I'm doing it wrong, where I've just learned from you today. What I really need to be saying is, don't ask how you doing. It is bring up something specific to say, hey, I noticed this was going on. Tell me about it. And you put them in that area where they can't avoid this. I'm trying to say corner anyone, but to answer you, they need to be truthful and honest. And hopefully that discussion, will take thoughts somewhere else. When we come back, we're going to talk about with Dr. Calvert here, particularly some efforts of dealing with students and institutions overall, because and we'll have a story to share that both she and I spoke about yesterday when we were in our private meeting on this. But it's something I think everyone should be held. You're watching UTMB Health Care Unmasked here on I-45 now.
UTMB knows when you're expecting, you may not know exactly what to expect. From that first embrace, to all the milestones that follow. We know how important each stage of life is. That's why UTMB Health's obstetrics and gynecology physicians specialize in innovative women's health care through all phases of life. UTMB knows women's health. UTMB knows you. To find an OBGYN specialist near you, visit utmbhealth.com/women's.
Back, everyone. TJ Ald's I-45 now in Galveston now with Health Care Unmasked. And we have our guests talking, as I said, extensively today about mental and emotional health. And we wanted to be able to discuss a part here. Dr. Calvert, one of the things, I'm glad you brought this up, but there's a story I shared with you yesterday. You were familiar with a graduation back in the early aughts, I should say, for that it was a medical student who was given a posthumous medical degree. And when I heard that, I went over to Raul Reyes, who was the director of communications at the time, and asked him, what was that about? He says, well, and I'm not so sure. And check. And the next thing I know, I get a tap on the shoulder. And it was Mr. Hughes, the family, the father of this, who himself a doctor, should point out. And so he sat down with me. And to this day, it is something I thought was one of the most important conversations I've ever had in my life, much less as a professional, because I did a story on it. But as a professional, it's one thing. But in my life, just to hear from him, a lot of people don't realize how stressful it is to be in medical school. And there are signs. He said later, yeah, we recognize, but our son just, we had no idea he would do what he would do. And they have since taken what could have been such an unbearable pain and have kind of turned it. Explain a little bit about what the Hughes family is doing at UTMB.
Yeah, we are very grateful for all of their efforts to help our UTMB students. Dr. and Mrs. Hughes come every year and speak to our first year medical students about just mental health struggles, help decrease that stigma, and help encourage our first year medical students to seek help and to deal with any concerns that they have as early as possible. And really emphasize that there's no issue that is too big or too small to go seek help for, and really help decrease that stigma. That's something they've been doing for years now, and we're very appreciative and grateful.
Yeah, and it's Justin David Hughes' family. I avoided saying the name, but I was reminded here just now. And that fund that still goes on. And in fact, when we had the Shrimp Fest, the run actually goes as a fundraiser. So those of you who do the Yagas Shrimp Fest run will know that goes to contribute to that. And it is. I think I just say it's just so brave of someone to come forward to take on this type of approach to things, where so many people you wouldn't blame them if they just went away, didn't want to do with anything, but it was so important to them to make sure that their son's death came out with a different meaning at the end. I don't want to be too superfluous with this, but to be able to say his degree's gone to work and helping people, which is what he was getting his medical degree for. And it is great for them. But that's also kind of sparked an effort you want to promote of looking overall in institutions overall, right?
And really over the past 8 years or so, we've seen a lot of changes at the systemic level, which is great, right? Because a lot of times at a more systemic level, you can have much more of an impact than an individual level. And so the UT system over the past 8 years has put over $25 million into student mental health across our academic, traditional undergraduate institutions, as well as our academic health centers. So creating a student crisis line specifically for UT students, they have 24/7, 365 access to mental health professionals day and night that they can contact if they're in a crisis. They've also helped increase funding for bystander intervention, which bystander intervention training is exactly what we were talking about earlier. Mm-hmm. Training on how to deal with someone who might open up to you as a friend, saying that they're having mental health concerns or thoughts of ending their life. so that you know how to address it and how to direct them to the appropriate resources. So I would encourage anyone listening to see if their organization or institution, employer, a group they're a part of offers that bystander intervention training in any way that they can seek out to be better prepared in those instances. And the next one we're rolling out is telehealth services for all UT system.
Oh, how wonderful.
Students. Yeah, it's going to be great. It's going to increase the flexibility of timing because students will have access to evening appointments, weekend appointments, and that allows them to more easily access the care that they need. So it's been very nice to be a part of a system that is really not just talking about and saying we need access and our students need help, but truly putting their money where their mouth is and truly funding these issues and putting things in place to help their students.
I think too is that you'd put it out is actually putting in the money, because it comes down to, you just can't just do this willy-nilly. And it does take a dedication and money. You probably see it in dealing with schools a lot.
Yeah.
Santa Fe is Santa Fe High School, which we just celebrated their 5th anniversary last week of the mass murder that happened on that campus. And after that, there was just a lot of talk, bullying and mental health, and these counselors were brought in, and they are still in the community and still part of the fabric. But then we saw other schools like said, you know what, we need to fund that position. But what I found is that here it is, that, and then we had Uvalde today, the anniversary, the 1-year anniversary of the mass shooting at Ross Elementary. People don't want to think about, hey, our schools need to be everything. Sometimes I think we ignore that, but how important is it for someone like you, a professional, to work with the schools, but also to make sure there's someone on standby, or at least on the campuses or in a school system, that understands what's going on?
It's extremely important. I would say probably more important than hiring more private practice therapists or individual therapists to work in the communities. That's a big question. I think, yes, that has to be the case. My degree is actually in school psychology for that reason. I work with children and my focus is on child mental health, but I got my training in school psychology specifically so that I understood the school systems and how to consult with them, because, I worked for years without that connection, and I understand kids are at home, they're at school, or they're in the doctor's office. So if I want to do good work with them, I have to be in one of those places. And the reality is that if I'm at their home, that's one kid that I can reach, versus if I'm at school or in their doctor's offices, I have access to support mental health across a much bigger population. So schools are essential. And I have to give a shout out to the Texas Child Mental Health Care Consortium, which was formed in 2019, Senate Bill 11, or 18, I'm sorry. And that legislative movement funded millions of dollars towards children's mental health in Texas. It's an incredible project that's happening, still going on, going very strong, actually, and recently refunded by the Senate. And, I'm really impressed with Texas recognizing not only the UT system, but recognizing we've got to do better. Texas had been ranking the lowest out of the United States in mental health access, especially for children. And like you said, they put their money where their mouth is. And what they've done is created this massive network across the entire UT system that addresses clinical issues in psychiatry and therapy. We have a massive telehealth program where we partner directly with school systems in the state. And we have, hopefully by the end of next year, every county in the state of Texas will be covered.
Wow.
It's pretty incredible. And I'm really proud to be a part of it. And it's all telehealth. So like Barbara was saying, there's access to areas that have never even seen a doctor, let alone a mental health provider.
I was just about to bring that up. We saw some excellent reporting from our partners at ABC 13 Houston about just general medical care in Wharton County, where my father ran radio stations for many years, so it was an interest to me. But they were talking about, trying to get into tertiary care there. Yeah. You got to go into Houston.
Yeah.
And that just becomes too much. And sometimes oftentimes when you're dealing with a mental or emotional health issue, you want to be able to talk to someone right away. Telehealth is a way to do that.
Yeah.
And having done a couple of telehealth sessions myself, I should point out that at first I thought you wouldn't get the personal touch for that, but actually it depends on how you are online, but it actually works. You've both have experienced doing that from the other end. Talk about, for you as a professional, what, using telehealth has helped in many ways.
Actually, research shows us that telehealth is just as effective if in-person treatment, as long as you're getting the solid evidence-based treatments that we want every patient to be getting anyway. And it also creates sustainable access, because we want to create access. We need more access, but it also needs to be done in a way that's sustainable. I think it's an adjustment for a lot of people in the beginning. They do have those concerns of not going to be in person. But over the past several years, with, of course, the COVID-19 pandemic and all of those things, we've really seen huge advancements in telehealth, and people's comfort with telehealth and acceptance of telehealth skyrocket as well. So providers are getting more confident in it. More providers have done trainings in telehealth and more knowledgeable about it, as well as consumers are more knowledgeable about it and comfortable with it.
Especially teenagers, so they live online anyways.
Well, I was about to say, right? I would think they're more comfortable.
Oh yeah.
I want to be stereotypical about that, but yeah,
it's pretty true. There's a small handful of kids that will tell me, "Can I see you in person? Can I just come to your office?" And I have to break it to them that I don't have an office. I do all telehealth, so they can't come see me at my home. But yeah, a lot of kids are very comfortable being on video online, and honestly, the ones that aren't, it can be therapeutic for them too. So it's definitely an easy method to do work with.
It's amazing. The technology is now, we talk about social media and things, but technology adding stress and adding some emotional baggage, I guess, in many ways, and also it is helping in many ways now to open this up. So there's the good and the bad, as we do with everything.
I frequently have patients who they call the clinic and ask to convert it from an in-person to a tele-session, which avoided them having to cancel an appointment because they weren't able to drive to and from the clinic
or get off work.
Those things.
Yeah.
So yeah, it's a great thing.
Yeah, and I folks have heard me say this before on the show. Is I'm a huge fan of telehealth, just on everything. It's like I go in to see my regular doctor every once in a while, but I like it when we can do the telehealth too, because I'm notorious for I'm going to be late, got to cancel my meeting. Well, let me just pull over to the side of the road and click it, right? And it works. Wherever I am, and it's more of just, hey, it's not convenient to get it out of the way. It is convenient so I can get something done within our busy lives. And in a way, it's also a time out in the middle of your day as well, maybe a little bit different than you would have otherwise. We've got about 15 minutes left in the show here. This is one of those topics where we can talk over and over and over again. When we come back, though, I want to talk about, because we have talked about ways to approach folks and things we're looking at in society overall, but there is a genuine need when we talk about bed space, when it does get into those crisis modes, and where Texas is still kind of struggling. Well, many areas are. And when we come back, we're going to have that discussion. You're watching Health Care Unmasked on UTMB.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB health specialist near you, visit utmbhealth.com.
And welcome back, everyone, to Health Care Unmasked on I-45 now in Galveston. Now, having Dr. Calvert just said this is fun, and I thank you for that, though, and Dr. G, you as well, because I believe that too. When we can have an honest conversation, as I told you all yesterday, I don't come in with prepared questions, and it's one of those things that have like, all right, let's just go as we go with it. And And this question I'm going to come to is actually prompted a little bit from one of our viewers who'd asked us earlier in the show. Let me go back up to what she said. And by the way, Glenn Laborde, thank you for your kind comments. He's been watching this. I know Glenn personally, and he's a big advocate of that. So, and Rhonda Mercado is asking about, and she's saying UTMB specific, but this is not unique to UTMB, about having, going outside their networks and not being able to stay local. That's a thing overall, because anytime we're talking about any type of healthcare, we're starting with, well, does my insurance cover that?
Mhm.
I mean, that's stopping a lot of folks of getting help. Have we seen some improvement there that you've seen across the board in any case of how it's gone for children, adults? And be honest here. I mean, there's, and I don't want, this is not going to be a political discussion. I mean,
Okay.
it is straight up, because it's not. I mean, it's a societal thing, because I've always said, like, okay, if you're not getting something, demand it.
Yeah.
And if you're still not getting it, keep demanding it. After a while, someone's going to fill that niche if enough people do it.
Right.
A lot of times, I think the question we heard there from Rhonda was, in which she was diagnosed as, too bad it's not this way, I'm out of the network and all this other stuff. But this is the first time she's probably voiced it anywhere, and it's here. Yeah. And it's not to the folks making the decisions at insurance companies.
Yeah.
So, as doctors, what, obviously what would you want to have just to see a step forward?
Mm-hmm.
Let's do it that way, without saying that you guys need to, I'm not tricking you to point a finger at anybody, but
except you should vote.
Yeah. Yes. I mean, it matters. It does. Well, no, it does matter. And I know I'm not going to put y'all in a political position.
That's okay. I'll try not to.
I have no problem with pointing out. I mean, we talked about, I agree. The state done a great job with putting up this telehealth across the state, making some adjustments. But at the same time, when we see another mass shooting, or we hear of another incident here, at the same time, the same folks that come out, politicians particularly, will say, we're going to do better. Mental health becomes this word.
Yeah.
And then it gets cut on one end. Say, oh yeah, we're doing this here. But on another end, that's also as vital, gets cut. And yes, you got to make some budget decisions, but what are you going to be priorities to be? And again, sometimes it's a political discussion. Other times it's like, okay, I think it gets pushed back because that stigma is still sticking out there.
Mm-hmm.
That this is a personal problem, and it's not something we should be funding. Let me get your views on that.
Yeah, I do think that the literature tells us that it is not a personal problem. It's a societal problem, and it's something that we have to address systemically, like Barbara said earlier. The schools have to be a part of this. Unfortunately, they're getting more cuts than anyone these days. And access to mental health care in particular, I think what Texas has done well is maneuver around that system of insurance, especially for children right now with this consortium project. The telehealth services that they're providing across the entire state for children are free. And that's part of the way we can do some of this work, is by using grant funding from different federal and state resources to provide services to patients at little or no cost, rather than having them go through their insurance. So I think the initiative has been really pointed towards children, because we know that getting help very early or preventing, poor health behaviors is primary in terms of a public health model. We know that we need to catch, any concerns early. And if there's no concerns to be had, then what do we need to do to strengthen these kids to make sure that stays the truth? So we're really targeting child mental health in Texas right now. But I know that adult mental health is an issue too, and that a lot of people just simply do not have access to care. I do think that not everyone needs therapy. So I think that it doesn't have to always be like, I'm struggling, let me go pay $200 an hour for a therapist.
Right.
Most people can't do that. And even $60, which is the typical copay for behavioral health services with any insurance, is a lot of money if you're going every week, as most evidence-based treatments recommend. But therapy isn't the only answer, and not everybody needs to see a therapist. There are plenty of community resources and people who are trained to support the things that we know impact mental health. But when it comes down to it, we are a federally underserved region, and there is just too little access to help when people who really need it are in crisis.
And I know I talked to our friends over at the Gulf Coast Center a lot on this topic. And, they're stretched
Very
as far as they could go right now. It's like a rubber band about to snap.
is,
Yeah. But again, that's why I'm saying, I mean, I know Rhonda had asked a question about UTMB specific, but it's not just a UTMB issue. It is everywhere. And, I was in South Texas for a while. My wife was running a college down there, and I was going back and forth, and I saw it firsthand, not just on the mental health side, but with all healthcare. I mean, we had the same insurance. It was handling things different down there than it does up here, for example. And that will stop a lot of folks if they make the call and says, yeah, it didn't cover that. So what does somebody do when they run into that problem?
Well, I think first off is seeing what options do you have. Like, for example, we are seeing an increase in insurance companies just offering telehealth basically through their app or things like that, versus like an individual having to go into an actual clinic. So like if you do not have access because insurance doesn't cover something or the copay is completely out of reach, looking at that resource and seeing what is available to you, or reaching out to the insurance company and saying what options do you have, what is available, to see if they can help connect you with someone or anything like that. Because I think also it's access overall, right? We think of access as just a lot of times a problem in rural communities like West Texas, for example, South Texas along the border, versus like here at a major academic health center, it can be a pretty long way to get into some of our specialties here, especially if it's a non-emergent situation. So access really is an issue overall because of availability as well as coverage. Like there's many different factors that go into that.
And I bring this up too because how much of the stigma, we talked about this yesterday. I think both of y'all told me that overall our society's gotten better, but it's got a long way to go too. Would that be a fair assessment on that?
Yeah.
How much of that stigma, that's a private issue, and we really want to get into that, and it's different for different. There's not a cookie cutter approach to this one. Every patient is individual. It's not like you've gone in, you've got a bad gallbladder. I mean, pretty much it's going to be within certain range of things. Someone's been trained for that. Someone comes into, with a 5-year-old to see you, that's going to be different from another family. It's going to come in with a 5-year-old to see you. It's not going to be the same thing. It's not the same approach. And I think that's part of the system. I like you using the systemic thing. I think that needs to be pointed out, that this is not necessarily people going out of their way to say, we're not going to do this. It's just no one's been willing to kind of take on the challenge to figure out how to get the culture to break and change out there. So what resources are out there that maybe not the traditional, I say traditional, but the way we think about it, traditional of go to a doctor, get help, go to a therapy session, get in a mental health bed.
Right. Well, I think one thing is just educating yourself on the things that impact mental health and starting there. So getting adequate sleep, exercise, good nutrition, social activity, good education or academic functioning, all of those things impact our mental health. And so sometimes it's as simple as starting with those things and kind of doing those self-checks. I do think too, like I said, the Texas Child Mental Health Consortium has created significant access for kids in public schools, and private and charter schools as well. So any school system can reach out to TCHAT and ask if they can be a part of it, and they'll direct them to the node that's kind of covering their region. So that's available across the state, and we're again rolling out to hopefully have the entire state covered by the end of next year, if not sooner. There's also Psychiatry, the CPAN network, which is advertised a lot on YouTube, so it might pop up on commercials. They have direct 24/7 consultation for PCPs to call psychiatrists and get information about mental health or behavioral health concerns. So PCPs are also getting support through this system. And then we also have research initiatives that are targeting specific vulnerable groups like kids with trauma or depression and suicide. and they can enroll in that research and get access to interventions through there as well. So that consortium is covering a lot of issues in the state. And I do think too that we're doing a lot of work in schools as well. I have a project going right now where we're going into schools and doing like a classroom takeover for high schools in our region and teaching them about what is mental health? How do we talk about this? How do we know if we need help? And the teachers and the counselors getting on board with that and wanting that program in their schools tells me that they're all aware that this is something we have to continue supporting and talking about. So helping youth really starts with helping the community. So schools, doctors, churches, coaches, like all the people that are part of a child's development, those are all people that can be helpful.
Go ahead. You were going to add to it.
It's also looking at, like, when we look at wellness holistically, it's about what aspect of wellness or health is off. Like, if someone's financial wellness is a big contributing factor to their distress, I might not be the best person for them to see. At that point, it's probably actually going to be more helpful for them to meet with someone who can help them budget, help them plan financially, so they start saving, pay off bills and debt, whatever it is. So I think that goes back to what Dr. G was saying, that not everyone needs therapy. When we look at wellness holistically, it's much more about much more than just our cognitive processes.
And the one thing I think is the general theme that comes out in every single show we do about this is you got to take the wholeness approach here. You had talked about that. Hey, what's happening in your life here affects other parts. You talked about too, finances affecting here, but getting out and just getting some exercise, make yourself feel better. But it all kind of, there's an interconnectivity to wellness. Is if you're working on total wellness, that can improve things greatly. And that's why one of the things I think is interesting at UTB, there's so many creating like centers of excellence for things so that everything's kind of under one roof, or, those type of things, which is, do we see how involved do you see is psychiatry and behavioral sciences in a lot of these areas around UTMB where we're seeing this expand?
We're getting better.
Yeah.
I think historically psychiatry has been more of like a consultation service for people. But we're definitely getting better at that. And the move in the field of psychology is to be more integrated. That's actually what my training is integrating with medical facilities to make sure that we're providing holistic healthcare, not just physical healthcare.
Right.
And UTMB, not just in the Department of Psychiatry, but we have faculty from across the university who actually work with our medical students on something called the physician healer concentration. That was developed by a physician here, Kara Geary, and the entire curriculum is a 4-year curriculum as the students go through medical school to learn about holistic healthcare. So learning about what it means to really heal or have a relationship with someone that's helpful. They talk about mindfulness, and they talk about things that we know patients need beyond just that check-in with their physician about their symptoms or their progress in treatment. So I think UTMB is doing a lot, and the nation as a whole and the industry of psychology and science is moving towards more integrated care. So you should continue to see physicians learning about behavioral health and learning about integrated healthcare as they move through the generations. So I think that should be really increasing. We should see a lot more of that soon.
So we're going to get y'all back on the show sometime.
Sure.
Seriously, I mean, we could go on for hours. Y'all both have things to get to, and I appreciate that. And I know you had said yesterday, if I knew it was going to be like this, I was to do more preparation work. But you were great. What y'all had off the top of your head is a whole lot more than anyone else could have. Let me ask, because we've seen this introduced. Galveston County has been on the forefront in some ways in mental health within police. Galveston County Sheriff's Office was the first in the state of Texas with a mental health unit. Still there. It's been going on for a while. It's had great successes. Galveston PD just introduced a program within that department as well. And we're seeing more and more of that discussion of going in, of where the law enforcement approach is, let's understand, is this really somebody who's, that is a criminal, or is this somebody that's really having a mental issue that we need to be dealing with because we're at a crisis moment here? How important do you think that is within the law enforcement community? Because it used to be, if law enforcement, for a lot of times, not a lot, but many times when they show up at a scene where there's a mental health crisis, someone ends up shot, someone ends up dead.
Yeah,
How are you seeing that in
yeah.
society improve, particularly is what we see here in our own county?
Yeah, I definitely think that's a major part. Again, that systemic resolution is not just one area or the other. And I know there's a lot of conversation about budgeting and, defunding the police and these conversations about how they shouldn't be doing that stuff. But the reality is that's who gets called. And they do need that support. They do need that training. And when cities invest in something like that, it only helps de-escalate these crisis moments. I've unfortunately had experiences like you described with my own adolescent patients or child patients who are in crisis, and that you have to call someone. And when that unit is not equipped to deal with that situation, it only makes everything a lot more difficult.
Right. And when you dial 911, you're not sure who's going to be on the other end as far as do they have the training to calm there? Does the dispatcher understand what it is? Does the officer who arrives first or at least have an idea to say, hey, call over this person who has this training and de-escalate the situation and go in. And I'm glad you brought it, because I think a lot of the conversation we hear about that was a term that should have never gotten out. I think most people who agree with that, and I've talked about that before when you say defund the police. Well, there's not one police chief in this country. I know many in this area alone who would not welcome the funding to say we're putting folks in with training in our patrol units. And we're going to have someone, maybe a medical director or something who has this training, be in our department. The jails are doing it now. The as I said, Galveston PD added it. Galveston County, has had that mental health deputies unit for a long time. It has been recognized across the country for what they've done. And I myself have been on many scenes with them and see them save lives.
Yeah, I call them all the time.
Yeah, and that's important. Calling them. Yeah. And having the whereabouts to know this is who we need to come out here as well.
Yeah, and most of the patients that I work with have no idea that that's a thing. So I love being able to educate them that there's a mental health deputy in Galveston County. You can call them and ask them for help too. Like if you have a kid that is out of control and fighting you and punching holes in the walls, like you're not alone. There are people that are able to help you. Yeah,
there are parents out there who feel lost as well. Yeah, with that, and that's another thing that if you're dealing with a child that has a situation, as a parent, you're feeling that even more so. You got enough stress in your life with work. A lot of times the financial resources are stretched thin. You pointed that out. Thank you all both for being on today. This has been, I really do appreciate Dr. Barbara Calvert and Dr. Kim Gushanas have been on with us here today. Talk about mental health within youth as well as young adults. You may have seen it. We popped it up on the screen, but if you go through our comment section, you can see links that our David Bethay has put up all the way over in class. In fact, he just put up the phone number. Oh, put up part of the phone number. You fixing it? Yeah. Of the Galveston, we have the direct line to the Galveston County Mental Health Deputy. There. See, he's quick. Dave works behind the scenes over there. Something just pops up. I'm thinking it, and it pops up right there. He knows it. And you can just call. That's the sheriff's office number, 409-766-2300. And there's someone available 24/7 to call. They may not get there in 2 minutes, but if you at least recognize that's a situation, so do that. But thank you both for being on today. We appreciate it. I know y'all were nervous, but it's great. I'm glad we got you in the studio. Yes. Dr. Gushanas was going to be so busy with because she does all telehealth. Yeah. I told we could get her hooked up and right here with the computer too. That we'll leave the room, let her get all that. But thank y'all both for being on with us here today. We do appreciate it. If you have questions about this topic or any others we've discussed, you can always get a hold of UTMB Health. Just go to the utmb.edu website, and then you just click where you want to go and find out more, or share this program with others that are out there, and because this is worthwhile information, whether you watched it live or watched it on recording. We appreciate you all watching today. This has been Health Care Unmasked on I-45 Now and Galveston Now, presented by UTMB Health. I'm TJ Alts.